I'm here with Adam Stormont, who's who's going for election at Vic Branch today at Medicines Management 2015. G'day, Adam.
How are you?
Very well. Adam's contributed to 2 posters at this exhibition, but he is going to talk about one about recovering debts in the health system, specifically at Monash.
Yes, Monash Health.
Yep. Tell us what you discovered.
Yeah, so at Monash Health we have a strategy that's entitled Living Within Our Means, and it's really about how can we make healthcare more sustainable. So actually looking at within the health service, where can we make savings that we can reinvest in healthcare to actually give back to patients and improve the care that we provide. And for pharmacy, the way we got brought into that was under the PBS, patients are charged a co-payment for discharge medications. So some of the care they receive in a hospital in terms of medication is free, but some of it they have to pay a co-payment. And because we put out the patients first and their care is very important, if they cannot pay for their medicines when they leave, they still receive their medicine. So we don't withhold them because that obviously wouldn't be very patient-centred. And so what can happen is patients who don't pay their bills for medicines, they sort of build up and bad debt can rise. And what we found was that bad debts over a number of years, it certainly wasn't a short-term thing, but over a number of years had grown significantly. And the finance department will decide when it reaches a point where they say, well, now we're going to write them off because otherwise it just keeps growing and growing, and then it comes back down again, and over time it builds up. And so what my team looked at with this poster is how can we actually work out a way to make a dent in those bad debts, so actually prevent them from becoming bad in the first place. And so it was quite a simple intervention. We surveyed about 300 patients across multiple clinical areas, emergency departments and inpatient wards across all Monash Health. We've got about 5 sites. And 4 simple questions. The first one was, are you, the patient, aware that under the legislation in Victoria that you're required to pay a co-payment for discharge medications when you go home from hospital? And just under 40% of patients said they weren't. So that was really staggering for us, that we've got nearly half of the patients that we surveyed weren't aware they had to pay. So you can't really, get angry at people for not paying if they're actually not aware they need to pay. So we thought about why that could be happening. We encourage our pharmacists to tell patients about the responsibilities of payment when they give their medicines out and provide the counselling, but people are busy, work pressure, so that can sometimes slip by. We also found out that the nursing staff weren't informed about the requirements, so they were actually telling patients on the ward that everything was free, and we're telling patients that actually need to pay a co-payment. So I guess if I was a patient and I've got one person telling me it's free and one person telling me I've got to pay, I know which one I'd be picking. So we had to obviously inform the nurses about the situation, so now they're better informed. We put some patient-centred information on TVs around the hospital that actually told them in very simple language about their medicines and the fact that there'd be a co-payment and that they would be expected to pay that if they could before they went home, but certainly afterwards if they didn't have money at the time. The next 2 questions were focused more around methods of payment. So actually if you're a patient and you're going to pay for your medicines before you go home, how would you like to pay for them? Do you want to pay for them by cash, EFTPOS, credit card? Do you want to send a cheque in? And if you're going to go home because you don't have money at the time, which some patients don't, how would you like to pay for them? Okay, and the results for that were pretty interesting. Most of the patients actually wanted to pay by cash or EFTPOS, but patients who wanted to pay after they had left the hospital, actually BPay was the most preferred option, and we actually didn't have BPay on our pharmacy invoices at all. So that was an intervention we took away, that we could put BPay on the invoice to actually get patients paying that way. We got some mobile EFTPOS machines that we could actually take to the patients. So when the pharmacists provide the medicines at discharge and provide the counselling and told them all their information about how to take their medicines safely and appropriately, we then said to them, and how would you like to pay for this? And then you've got the machine there with you. So if they've got their EFTPOS card or credit card, they can pay for them on the spot rather than actually saying, oh, now we need you to pay, and can you go and line up at the cashier 500 metres away when all they want to do is really go home to be with their family. So
these outcomes have meant that there have been savings and less debt within the system.
Less debt, and that can be reinvested into healthcare, maybe in pharmacy, maybe in other areas of the hospital, but certainly back into providing good care, and that's really important.
So part of your poster is to raise awareness of making payment easier.
Yes, absolutely.
And you're hoping other organisations will take it on.
Yeah.
Yep, terrific. Hope it's a success.
Thanks very much.
Best of luck. Thank you.
Thank you.